Hello guys, welcome to our channel Anything Medicine. So we already did many viruses, and as we now have the outbreak of the corona, I have to talk about coronavirus. Well, coronavirus actually is a family that contains many viruses, and regarding to our outbreaks, we can conclude that there's a new virus have merged now. So the viruses that we know that included under coronaviruses are MERS virus and SARS virus and COVID virus. MERS virus, the Middle East respiratory virus that merged in 2012, and SARS that merged in 2003 in China, and COVID that merged now. So these the three are the sub-viruses that included under corona. Well, now first we would like to begin with some famous questions and important questions about the new virus. Then we'll go for the general information about the virus. So first question, is the mortality rate high for this virus, COVID-19? Well, so we'll compare it with the other brothers of this virus. So we'll compare it with the brothers of this virus, and let's see. So MERS virus has 35% fatality, and SARS have 10%, while COVID have 1 to 3% of fatality. So it's not much as comparing with the others. And for example, just to imagine that it's not much fatal in comparison with other, we brought another virus as an example of high fatality, which is Ebola, and it has 40% of fatalities. So when we are going to the other questions, which is, it is really infectious? So again, we have to compare it with others, and let's see, conclude. For example, the beginning, initially, we didn't know how much it's infectious really. We didn't know about the contagiousity of this virus. But now we came to conclude that it's 2.5. So an infected patient, in average, can pass the disease to more 2.5 patients, to more 2.5 individuals, healthy individuals. It's in average. While on the other side, measles can pass a measles patient can pass the disease for 10 healthy individuals. Influenza, for example, 1 or 2 can pass it for 1 or 2. This called raw R0 index. So at the beginning we didn't know about the R0 index, but now we came to know, according to the statistics, that it's 2.5. And coming to the next question, which is how it is transmitted. Actually, it's still ambiguous. This point is still ambiguous. We still something not clear about this point. But we can suggest that it's transmitted through saliva droplet or air droplet, or through the contact. So you can get the virus within the droplets directly into your face by coughing or sneezing, or by your hand, by your hand if it gets contaminated. So we'll talk about how to prevent such transmission when we go for prevention. The other question, how long can it stay on the surface? Actually, it can stay on the surface of solid substances and the liquid substances more than in air. Yes? So in air it can stay just for couples of minutes, like maximum 30 minutes, while in the solid surfaces can stay from hours till days. For example, on the metal surface can stay more than 12 hours, and while in the clothes can stay 9 hours. So also we'll use this point for prevention. Now, coming to the incubation period, coming to the general information about the virus. Well, let's note that the virus, we didn't talk about the structure of the virus. Beginning, it's an RNA virus that is enveloped, and from this envelope merged spikes. So this spike called as spike. So coronavirus is an RNA virus which is an envelope, and inside the envelope there is a capsid which is helical shape, and inside this helical shape we can find the RNA. We can find the RNA code. So this is the RNA presenting inside the capsid. It has approximately about 3,000 genome in comparison to us, which we have 14 billion genome. So what we can say, why we have a new virus merged? What's the difference between COVID-19 and other viruses, other brothers of this virus? Just imagine like four pieces of the gene get mutated, and this mutation result in more affinity spike toward the host cell. That's it. So we just were unlucky by getting a mutation for 4 genes, not more, 4 genes that result in more affinity spike toward the host cell. So how this spike work? This spike called as spike, yes, as we said. So let's imagine this is the respiratory cell which have receptor. Now these respiratory cells have an ACE receptor, ACE2 receptor we call it, and this S protein get interacted with this ACE receptor, resulting endocytosis of the virus inside the respiratory cells, and then the virus will work by still unknown mechanism inside the cell, but finally lead to destruction. So why we have the new virus? Again, a new mutation in the 4 genes among the 3,000 genes that resulted in more affinity as protein towards the host cell, which is the respiratory cells. Now, once the virus enters the cells, the respiratory cells, it will lie dormant for 7 days. And again, we notice here that in between the patients there are different incubation periods. So some of them can have 2 days incubation periods, some of them can have more than 7 days, some of them 7 days. But according to the statistics from China, this is the medium average. So patients, once they infected, they spend 7 days incubation, 7 days of incubation. Then at the 7th day, they got admission to the hospital. Then at the 8th day, they got dyspnea. Then on the 9th day, they got acute respiratory distress syndrome. Then on the 9th day, they were transferred to the intensive care unit due to the complication. And let's say, what's the symptoms of this virus? As this corona family, defined as respiratory family, so we can expect that the symptoms mostly will be respiratory symptoms such as coughing and dyspnea, and due to intoxication there will be fever. But the new about this virus that it has GIT symptoms. There are some reported cases with GIT syndrome preceded the respiratory syndrome. So this put a question here, something about the transmission way. Maybe unclear. Maybe this virus also transmitted through GIT, and then from GIT goes into blood, and from blood into lung. So that's why still not everything is clear about the virus, but we say just the proved things. We say the medical based evidence. Next fact is the virus unlike influenza, the coronavirus, unlike influenza, tend to affect the elders, not the child. So rarely we see an affected or sick child with corona. And mostly the people who die from corona is those people who have a chronic medical diseases such as hypertension, diabetes, AIDS. Okay. And coming to the prevention. So what I can suggest about prevention is to wash the hand before and after the contact, even with a healthy person or an ill person, even if it was corona patient or any sick patient with any other disease. Next, what I can suggest is to stay in a containment whenever you are sick, and plus also to keep with you the antiseptic anyway, to use it for before and after contact. Also avoid traveling to the infected areas, and also avoid touching your eyes and nose and mouth. This is the T-zone, which is known to be the site of infections, of many infections. Okay, and finally we would like to mention the statistics up to now, 5 of March. 5 of March, we have got 95,748 reported cases of infection, of corona infection, and 3,286 already died, unfortunately, and on the Y, 53,423 recovered already. So this the information that I would like to tell you about corona. Finally, what I want to say, stay healthy, wish you the health, and thank you.